Well, welcome. Thank you to everyone who is joining us this evening for this community conversation about the youth vaping epidemic. I am Nikki Maurer-Gray. I am the Executive Director of the Community Health Council of Lebanon County. I also serve as the Mission Chair for the American Heart Association's Lebanon County Board of Directors. I'll be helping to guide the conversation. That includes some of the questions that you, our attendees, submitted ahead of time when you registered for tonight's event. We hope our discussion today will help you learn about the effects of tobacco and vaping and its impact on our youth, hear how schools are addressing the student vaping epidemic and helping students quit, learn to identify vaping devices and products and talk to your child about vaping, and hear the perspectives of local students who see the impact of vaping among their peers. Before we get started, we want to thank the sponsor of today's conversation, WellSpan Health. Thank you to WellSpan for their support of the American Heart Association throughout the year in Lebanon, Lancaster, York, and Adams County. We also want you to enjoy your Zoom webinar experience. We'll have live speakers and some slides throughout the event. Use the sliding bar between the two to adjust the size of each window. The chat, webcam, and audio features have been disabled, but we will be addressing some of the questions that you submitted prior to the event. It's my great pleasure to be joined today by 5 other distinguished panelists who will be speaking with us over the course of the next hour and sharing their expertise. Dr. Scott Silverstein, pulmonologist at WellSpan Ephrata Community Hospital. His clinical interests include sleep disorders, allergy, and asthma. He's certified by the American Board of Osteopathic Internal Medicine in internal medicine and pulmonary disease. He was recently chosen as a Lancaster County WellSpan Physician Champion. He has a particular interest in vaping and has given many talks about vaping with students, teachers, nurses, and administrators in Lancaster County school districts. Dr. Silverstein earned his degree from the Philadelphia College of Osteopathic Medicine. Samantha Smith, community health specialist with the City of York Bureau of Health. Samantha has been with the York Bureau of Health since January 2020. Her work concentrates on substance abuse prevention for the Bureau, working to create a healthier community with a comprehensive approach that includes coordinating response activities, educating the community on opioid and substance abuse issues, providing evidence-based interventions in the community, and collaborating with other local partners to develop strategies. She obtained her Master's of Public Health degree from the George Washington University. Holly Dolan, Vice President of Community Education for Lebanon Family Health Services, a service provider leading tobacco cessation efforts in Lebanon County. Holly has been a health educator in adolescent school and community health for over 20 years. Her current work involves coordinating health education programs in Lebanon County school districts, college campuses, and community groups, including programs such as the Tobacco Resistance Unit Youth Prevention Program and the Young Lungs at Play Tobacco-Free Playground Initiative. Holly holds a master's degree from the University of South Carolina School of Public Health. Brandy Sheeler, school social worker for the Red Lion Area School District. Brandy is a licensed clinical social worker and certified home and school visitor. She has worked in alternative education in public schools since 2008. She currently serves the Red Lion Area School District as their secondary social worker, focusing on addressing mental health and resource coordination for students and their families. She co-facilitated the NOT Smoking Vaping Cessation Program in 2020 with WellSpan Health and is trained in the Project Connect Vaping Cessation Program. Brandy plans to start her doctorate in social work in August 2021. And finally, Isaiah Morales, Student Council President at Red Lion Area High School. Isaiah is a senior this year at Red Lion. In addition to serving as president of the Student Council, he's active within his community, including volunteering at community events for the American Heart Association, and hopes to gain experience in public service. He'll be attending Penn State University, majoring in public policy, and hopes to run for office in the future. Thank you all for being part of our conversation today. We're going to start today's conversation with Dr. Silverstein. Hi, Dr. Silverstein.
Hi, Nikki.
Most e-cigarettes contain nicotine, the addictive drug in regular cigarettes, cigars, and other tobacco products. What have you seen in your practice as a result of vaping use, both how it affects a young person's physical and mental health?
The brain develops in all of us up until about the age of 25. So children, adolescents, and young adults are particularly susceptible to the negative effects of nicotine. Obviously, we talk about nicotine addiction and nicotine withdrawal, but it's really important to know that nicotine can very negatively affect mood disorders, impulse susceptibility, impulse control, memory, learning, and attention. Nicotine's also been shown to negatively affect fetal growth and fetal development. And also, nicotine can absolutely increase the brain's risk of developing other addictions like to cocaine.
Wow. What should parents know about the effects of vaping on the body?
I think the biggest thing to be aware of is nicotine addiction and nicotine withdrawal. Nicotine addiction, if you use nicotine, and as you know, vaping devices, almost all of them have nicotine. So especially in youth, in middle schoolers and high schoolers, if you use nicotine and vape 20 out of 30 days a month for a period of just 6 months, you're going to become dependent on nicotine. And then you're going to also go through withdrawal. When you stop using it. So you basically go through the wanting, the craving, and the needing that goes along with that. And if you just think about this, we're talking about kids in school. So if they go to school and they're not able to vape, they will start to go through withdrawal during class. They start to get depressed mood issues, sleep disturbances. They can get anger, irritable. They can start to sweat. They can develop anxiety, significant troubles concentrating, sleep disturbances, and all these things affect academic performance.
Does starting vaping at a younger age increase the risk of serious health issues in the future?
That's a good question, and the answer is nobody knows. The uses of vaping started about 10 years ago, and it was originally developed to allow older smokers, older weazened smokers, to stop smoking. Very unfortunately, big tobacco and companies that bought $1 billion industry have figured out how to make it appeal through different types of vaping devices and through flavors to a much younger market. Once they've gotten kids addicted to nicotine, it's been a little bit easier flow for them. But what we don't know is the long-term effects of what vaping can do. We know that in vaping aerosols, there are some serious bad things, particularly volatile organic compounds. There are chemicals that have been associated with cancer, ultrafine particles, heavy metals. There are all kinds of different things that have potential long-term ramifications. But unfortunately, the epidemic in kids has only been over the last 5 to 7 years, and we have no long-term effects. What we do know, Nikki, and this is, I think, really important, there is a 7 times higher likelihood of younger people transitioning to cigarettes to get higher levels of nicotine. And we all know that if you start at a younger age, particularly if you start smoking cigarettes, we know very much what those long-term effects will do.
Wow. So here's a great question. Unlike the smell of cigarettes, we know that vaping can have no odor at all, or it can smell like one of the many available flavors of vape juice, like apple or vanilla. Are there physical signs that a parent should be aware of to know their child might be vaping?
Yeah, and I think a couple things. First of all, not necessarily signs, but if parents find certain paraphernalia, if they find vaping devices that look like pens that aren't typical pens, or they find thumb drives or zip drives that are much longer than usual, which are seen with Enjoys or Juuls or things like that, they should immediately have some suspicion that this could be going on. Obviously, if they start to smell things like cotton candy and fruity smells emanating from rooms, that's a high, suspicion that their child could be vaping. You start to look for things such as behavioral changes, mood changes, agitation. We start to look for troubles with concentrating, sleep disorders, trouble sleeping. We look for gum disease. We look for cavities where they didn't have them before. We look for sore mouth, sore tongue ulcers. We look for chest pain, shortness of breath. We look for nausea, vomiting. and particularly weight reduction, weight loss. The big issue is troubles concentrating at school. So if a parent starts to see poor performance, especially in their child where it wasn't there before, that's a red flag.
Thank you so much, Dr. Silverstein. I know we're going to look later at what some vaping devices look like, so I'm glad you referenced that. Really appreciate having you on tonight. Thank you. I'd like to move on to Samantha Smith from the York Bureau of Health. Hi, Samantha.
Hi, Nikki.
Samantha, what data can you share around the vaping issue in the city of York and how you're addressing the challenges there?
Yeah, sure. So the Pennsylvania Youth Survey, also referred to as PAYS, is conducted every other year and is distributed to students in 6th, 8th, 10th grade, and 12th grade, and assesses their knowledge, attitudes, and behaviors towards alcohol, tobacco, and other drugs. In 2019, the 30-day use for all grades of vaping in the York City School District was 14.5%, and compared to 16.2% in York County and 19% at the state level. Also, the most commonly vaping substance used by students, indicating electronic vaping product use in the past year for the York City School District, was just flavoring at 51.4%, and that was compared to 46.4% at the state level. And how we're addressing this is that the York City Bureau of Health promotes tobacco-free events and environments, and we also work with community partners to engage in discussions and provide resources. We also encourage parents to have open conversations and create an environment where teens feel comfortable discussing information, asking questions, and sharing.
Thank you. I know that the PAYS level county data is available for anybody to look up, and maybe we can get those resources out to participants. Samantha, what impact is vaping having on the youth in York, in your opinion?
The most predominant concern is the effect of nicotine on the adolescent brain, and obviously, the developing into the early to mid 20s. Vaping exposes young people to nicotine at a time when the human brain is still developing, and obviously the most risk for addiction and the harms to the adolescent brain development. Tobacco product use in any form is unsafe for youth. And vaping is not just a problem in York County, but the risk of addiction. Obviously, research shows that vaping has often the first substance at a young person's use and is associated with a future risk of multi-substance use. There's an early onset of vaping use was significantly associated with an increased odds of cigarette smoking use and other substance use behaviors.
Right, right. What do you think communities can do to keep vaping devices out of the hands of youth?
So everyone has an important role to play in addressing this public health epidemic. So setting a positive example by being tobacco-free, knowing the risk, and taking actions. We know that implementing evidence-based population-level strategies to reduce vaping use among young people has been successful. And some of these strategies include implementing policies, restricting access, raising prices, and developing educational interventions and conducting media campaigns targeting young people.
Great. Samantha, thank you so much for your time today.
Yes, thank you, Nikki.
Thanks. I'd like to move on to my Lebanon County colleague, Holly Dolan.
Hi, good evening, Nikki.
Hi, Holly. I'm so glad Samantha brought up some of her intervention ideas in her last answer. I'm interested in how you're working with the schools to address student vaping.
Sure, thanks, Nikki. Yeah, in Lebanon Family Health, we've been working on youth vaping for quite some time. I heard Dr. Silverstein talk about how it's kind of emerged about 7-8 years ago. And I'd say that's, yeah, pretty accurate with how long we've been kind of seeing this issue come to rise. And with that said, we've been focusing a lot of youth programming on trying to address and make awareness about youth vaping, mostly through a program we call TRUE. TRUE stands for Tobacco Resistance Unit. So yes, we use it to educate about tobacco, but vaping has really been the #1 issue for youth. And what TRUE is, it's really a peer education program where the teens become the advocates, and they deliver the message, because we know that teenagers are more likely to listen to this message from other kids their own age than they are from an adult. So what we do at Lebanon Family Health is we go in and we work with the youth, and we find the youth leaders, whoever the leader, movers and shakers, the leaders in the school, and work with them to educate them about vaping and the health effects and mostly the marketing practices of the industry. And they take that and they turn it around and they turn it into a program that they bring to their peers. So we've done things like we teach them about the health effects, the marketing practices of the industry, and then they turn it around into an activity. We've seen schools use it at their Thon events, what they have every year. One of our school districts did a big school-wide assembly where they did a Cahoots interactive Quizlet game, and then educated the student body, had displays at lunch educating about vaping. We've had a lot of groups go down to younger students, like the high school kids would go down to the middle school or the third graders and educate down there, because we also know middle school is where it really starts. So the idea is to empower youth to deliver the message. One of the big things we can do, obviously, is for them to become advocates, but also to become advocates on policy. So every year we bring students to the Capitol to go talk to legislators and advocate for tobacco prevention programs such as TRUE. So that is a big part of it, is we want youth to be that voice. We also do participate in, you mentioned before, the PAYS data, but we participate in the Pennsylvania Youth Risk Behavior Study, where at Family Health, our staff goes out and administers this data through the school districts in our county. So we have had our pulse on the front lines of the data since the beginning of this epidemic. And I will get to it later on some of the data that we have seen come out over the past few years that's been quite alarming.
Wow, that was a really great explanation of that, the TRUE program. So what other resources are available to schools and parents to help prevent student vaping?
Sure, thanks. I'm glad you brought that up, because while we've been focusing so much on awareness and prevention and education over the past 7 to 8 years, we have really seen coming down the pike the need for cessation. So what we are starting to work on is a program called In-Depth. In-Depth stands for Intervention to Nicotine Dependence. And the idea is it's a forward-thinking alternative to suspension, so that when schools catch a student vaping or breaking the policy, the tobacco policy, instead of having punitive measures, we look at how we can intervene in an alternative to suspension that is helps educate them about the dangers of vaping, and with the hope that they will turn on to eventually quitting and cessation. In-Depth is 4 sessions at 50 minutes each. It can be done in a group environment, or it can be done one-on-one. So instead of punitive measures such as suspension, we say, well, let's refer students and educate them about what's going on, because the reality is a lot of these kids just don't know how dangerous this stuff is. And what we've seen with the outcomes of the In-Depth program, the preliminary data showing 71% of the students that enter the In-Depth program are there because of the vaping. It's not traditional cigarette use or it's a dip tobacco. It's really vaping. So 71% of them are vaping. But we found that once they go through the In-Depth program, 61% of them report that they would like to quit. So that's very hopeful. So we're really hoping to get that program off the ground, because we are seeing this beyond epidemic proportions. Another program we are working towards implementing is what we call NOT. It stands for Not on Tobacco. And this is an interactive program that gives students the help they need to break the addiction from vaping and to quit vaping for good. So we're hoping once they go through In-Depth, they will move on to cessation as well.
Absolutely, that's great. And I know that we know from our local PAYS data that a lot of kids don't know what they're vaping. So the idea that they could be getting addicted to nicotine and not even know it, these cessation programs, I think, are going to play a big role in the future. So I know that you work a lot with parents. What do you find parents are the most surprised to learn about vaping? Like, what do they need to know?
You know, Nikki, I'm going to answer your question with a story, with an anecdotal story that I think really speaks to the data that we have seen come out in the past 7 to 8 years. As I mentioned, in family health, we've been really trying to raise a lot of awareness to this issue over the past 7 to 8 years. As Dr. Silverstein said, it's been kind of emerging. And one of the most illuminating stories that to me as an educator, but also as a parent myself, was one day I was out in one of our area schools, this was about 8 years ago, and the teacher had called me to do just a traditional tobacco education lesson, which, you know, did the traditional lesson. And we finished a few minutes early, and I had been hearing the buzz about this whole e-cigarette thing. And so I said to the kids, I said, can you all tell me a little bit about this e-cigarette thing? Have you all ever heard of it? Now, this is about 8 years ago. And this one kid in the class says to me, he goes, oh, those e-cigarette things, they're great because you can smoke them in your bedroom and your parents have no idea because it smells like grapes. And that was the most illuminating story to me, not as just a health educator, but as a parent as well. And what has transpired in the years since I heard that story about 8 years ago is that that story has paralleled the national data that we've seen. Since that story, our YRBS data showed that 3.4% of youth reported being frequent users of vaping. That was in 2014. I'm sorry, in 2014. In 2019, it tripled to 10%. So we have seen the youth use of vaping triple in that period of time since I met that kid. And that's exactly what was happening. This industry has been so deceptive and been fooling parents. Like this kid just said, I can smoke it in my room and it smells like grapes and my parents have no idea. And that is exactly what they've been doing. Later in this program, we're going to see a picture of the evolution of the devices that have transpired in the past 7 to 8 years. They used to look like little cigarettes pipes. Then they've evolved. They look like USB drives. So, you know, that you could put in your computer, or they look like pens. They've also gone from having smoke to being smokeless. We've seen kids do things like hide them in their bra strap so they can suck on the nicotine during school. We've seen them sew little pockets in their sleeves so they can be juuling all day long. We've seen kids hide them in the ceilings in the bathrooms. I mean, they have been able to get around this and the industry knows it. So these are things parents need to know, that the kids are juuling or vaping all day long, taking in this nicotine at such high concentrations, as Dr. Silverstein talked about, you know, goes into the brain at such a high level and is causing addiction at such a young age that we are looking at a generation of addicts that we're going to have to deal with in the coming years. Another thing parents need to know is that this industry is clearly trying to appeal to kids. We see it in all kinds of flavors, from grapes to gummy bears to things like that, flavors that are appealing to kids. And we know that these chemicals are linked with serious lung disease. Diacetyl, which is the chemical that is used for this flavoring, causes like a what we call popcorn lung, or a scarring of the lung tissue that is irreversible. So we're seeing generations of kids becoming addicted and lung diseases that are irreversible. With traditional cigarettes, we've seen the lungs be able to heal over time. Even like we do freedom from smoking at Family Health too. We see even in 2 weeks, the lung can start to recover. But with the vaping, it's irreversible lung damage. So these are things parents really need to know. There's a lot of misrepresentation of vaping by the industry. It's often referred to as water vapor, and it's not water vapor. It's often referred to as not being as bad as the traditional cigarette, but as I mentioned, it's irreversible. And some of the e-cigarette, when you have an e-cigarette, there's not a beginning and an end to it like a traditional cigarette. As I mentioned, you're sucking on this all day long, and one e-cigarette is equivalent to 20 cigarettes, or a whole pack of cigarettes. So they're taking in really high levels of nicotine that's highly addictive, and we know that it's predisposing the teenage brain, which is still developing, to future addiction, and has as Dr. Silverstein mentioned, long-lasting effects on impulsivity and mood disorders. A last thing parents need to understand is also the advertising practices of this industry. They're rehashing old practices that go back to the 1960s, 70s, and 80s with unsubstantiated claims about being a cessation device, unsubstantiated claims about benefiting health, appealing to kids through our social media, on YouTube, through video games. They're really knowing where to find kids. And lastly, they're using all the old advertising strategies that we saw in the 1960s and 70s, such as like use of celebrities, the sex appeal, and a lot of just unsubstantiated false claims. So these are things, a lot of things parents really need to be aware of about the deceptive practices out there by this industry.
Right. And I think you mentioned, probably the most important one that I heard you say is that, parents think it's safe. We know a lot of parents who definitely think that it is better than smoking or not unsafe at all. I'm glad you brought up the school districts, because I know that our school districts have really been struggling with this issue. We hear anecdotally from our superintendents here in Lebanon County about the wild array of devices that kids are using. So in your experience, how can school districts work together to address the student vaping problem in a unified way?
Absolutely. There's a lot of great ideas out there that we see now as public health practices that we could be working together to do. I've already mentioned the in-depth program and the NOT program of using non-punitive measures that are supporting recovery from addiction. Another thing is really illuminating policy. I think Samantha spoke a little bit about policy. That we, as public health, the world of public health, it's advised that for school districts to consider addressing violations with a graduated set of evidence-based supportive disciplinary practices that promote recovery and reduction of tobacco product addiction and dependence. So what I mean by graduated, like for example, on your first violation, there can be a collaborative conversation between a student and a designated staff member and encourage them to go into the in-depth program. At the second violation, there can have that conversation continue again, including the parents, and this time really recommending that they go into that in-depth program. Further subsequent violations, we should have that conversation also include maybe a professional in the world of chemical dependency and address the real issue of addiction.
Holly, thank you so much for all your information tonight. I think you've had some really great points, and we'll be sure to send out some of those resources that you talked about.
Thanks, Nikki.
Next, we're going to speak with Brandy Sheeler from the Red Lion School District. Hi, Brandy.
Hi, how are you?
Great. Brandy, how would you describe the youth vaping problem at Red Lion High School?
Sure. Well, it's not just at the high school, unfortunately. Typically speaking, the students that I work with are at the secondary level, but we do have some students that are getting into some trouble around 6th grade. So typically I will work with students anywhere between the ages of about 12 on up.
Wow.
Unfortunately, yes.
Wow. So, wow. Yeah, I was just about to ask you, at what age you're starting to see students vaping. We know from our PAYS data also that's available, that it really is starting in the middle school. What age group tends to vape more than others? Like, is it a slow burn up into the high school years, or, oh, that was a bad pun. Or, is it, did it get kind of heavy in the beginning and then taper off?
I see once it starts in the junior high level, I don't really see it tapering off at all. Typically what I see or what I hear from students would be, if they're vaping, then they introduce it to others. So it does sort of spread, which is the unfortunate part. So I would say that the age range that I typically see vaping the most is, again, going to be our 7th, 8th, and then it seems like the 9th and 10th graders. And then I don't see them, at least they don't come to me as much for violations once they get into like 11th and 12th grade, but I don't believe that's because they're not vaping. They maybe are better at hiding it, perhaps.
Right.
Yeah.
And I know that you've been a facilitator of some of the programs that Holly spoke about. I do want to make it clear that a lot of those programs are free to kids. Like this is not something, you know, that it would cost parents anything, or it doesn't, and oftentimes it doesn't cost the school districts anything to add that type of program. Do you think that parents, we've talked a lot tonight about what vaping devices look like. I wondered if you had any examples that we could share with our group.
Sure. They're able to still see me, correct?
Yes.
Okay. So yeah, when you do look at the evolution of, you know, the vaping devices, you can see that they are getting smaller and they're able to be concealed a lot more. We used to see a lot of the Juuls, which were the things that look like the little flash drives. The things that we're seeing in the high school now are the Views Altos. These are super popular right now. This is one of the main ones that we're seeing, and the cartridge is inside. Yeah.
Oh, wow.
Yeah. The cartridge is inside. You can see I have 4 of these here, and every one of them has menthol flavoring. I think the reason why we're not seeing as many Juuls is because there was the ban on the flavorings, and so the students really do like the flavoring. So they're going for the menthol if they can't get the flavoring. So I think that's why I see that so much. But again, you can see here's another one. Again, wow. They're all 5% menthol. This here is a puff bar. These are disposable devices. Okay. This is called it's peach ice, and the students absolutely love these. They tell me that if it has ice in the title, that it gives them an extra, they call it a burst. It gives them like an extra high. They love anything that has ice at the end. So your peach ice, your grape ice, these are very popular. And again, these are disposable and they're not that expensive. Again, these all came from Red Lion. So don't think it's not in your schools or in your communities, because it is. This here is a little bit different than what we've been talking about, but this is what the kids call a dab pen. Okay. So this actually has THC in it. So this is, you know, the psychoactive ingredient in marijuana. And the student also brought, you know, an extra cartridge.
Wow.
And so when we have this type of stuff, this obviously amps up a little bit the level of severity with it. But the really sad thing is our students are using these. They're using them, you know, in our bathrooms, in our hallways, you know, in the locker rooms. And I know Isaiah will speak more about that, but it's unfortunate. Just to show you too, with the Alto, they do have a charging cord with them. So you would just plug this in like you would, you know, any other device, your phone or whatever, and then you just put this right on the base. And, you know, you can use it while you're charging. So if you ever see this on your students' on their wall or whatever, you know, take a closer look at it, because it may not be just a flash drive. This one looks like it's been dropped a few times, but.
Yeah, and just to remind folks, you know, you can slide that. I maybe should have mentioned this a few minutes ago. But you can slide the viewing tool over in your Zoom to see a little bit, or change your view actually to speaker view, and you might be able to get, if you want to maybe show up a little
them up again, or
yeah. I think Holly made a great point. You know, we don't see a lot of adults going after the cotton candy flavor or, you know, peach ice. I mean, maybe, but
yeah, that's what I tell the students.
Clearly marketed.
I tell the students all the time, I said, if this was really the wonder product that everyone is making it out to be, they wouldn't need to market it to children, and it wouldn't look like unicorns and ponies and all of those types of things.
That is such a good point.
And there's and this just comes in, it comes inside of another tube. Then this one, actually, I have to wear gloves with this one because it is cracked, but you know, this is, again,
I see.
Yeah, so there's some liquid still in that. So
got it.
Yeah.
So Brandy, what is your school's policy on vaping, and how do you guys handle the situation where a student is caught vaping or with products on school property? Clearly they're confiscated, because I'm assuming that's how you got them.
Yes, they are confiscated. That policy, we're really working on aligning that with our handbook, because in our handbook, it takes a really hard line. It recommends suspension for 3 days for a first offense. Second offense, it could be 5 days. Loss of sporting privileges and clubs and activities. But we really know that it's an addiction. So suspending or expelling someone for an addiction isn't going to solve the addiction. So we really are in the process of realigning some of those policies. But again, what we do still have some fining of students because it is a violation of the smoke-free campuses and things along those lines. So we will fine. Occasionally there will be a suspension. But a lot of times what we do is we will refer to our student assistance program.
Got it.
Or the student will come and see me.
So the response could be both punitive and perhaps get them in a cessation program. There is a process in place to help kids quit.
Absolutely. So for any student that at the high school level that has a violation, they will come and see me, and I do. It's about an hour-long psychoeducational group. I used to do it in groups, but now with COVID, I just do it individually, one-on-one. But I talk to the students about the process and how they got there. And that's where I did get some data from students telling me that they've started vaping as young as 9, 10, 11 years old. So it's really nice to be able to speak to students that way, because you do get a lot more information. But absolutely, we are not looking to be punitive. We want to educate. And then obviously, if students are interested, we can do cessation groups with them. I'm also, trained in some of those cessation groups. And, I've also explored the in-depth that Holly spoke of before. So it's really a process of just trying to keep up with what the students are doing and then making sure that we're targeting interventions for it.
Right. I don't want to put you on the spot, but I know you mentioned earlier about the vaping devices not being very expensive. Like roughly, what are we talking about? Do you know?
I don't want to say for sure, but I know I was just looking up the puff bar that I had. And I don't know if it was a sale or what, but it was I think it was around like $10 to $12.
Wow.
So I don't think they're
but like a
expensive.
pack of cigarettes in one of those, or
Yeah,
that's the equivalent of right. So about what maybe cigarettes cost.
possibly. Yeah. Some students tell me it's cheaper. I think it just depends on where you're getting it.
Right. So what does Red Lion plan to do in the future with their vaping policies? Are there plans to evaluate and update your policies?
Oh, absolutely. It's an ongoing process, honestly, because we're really playing catch up. All of us here are playing catch up because our students they know what the latest things are. They know what the newest trends are. So we're really trying to keep up with that, make sure that our language is appropriate. Our language is kind of up with the times, because if you say juuling anymore now, kids are like, Miss, we don't juul, so it's just trying to make sure that we're up to speed on what our students are actually doing. But absolutely, we know that it's an addiction, and our students are coming to school with an addiction. And I know someone mentioned again with the withdrawal symptoms and all of those things, we need to treat it as an addiction, not as a behavior that we need to discipline, because that's not going to get us anywhere.
Right.
If we don't educate and then try to support it, we're not really doing anything.
And that's where I think some of those peer-to-peer relationship programs come in, because they do listen, to other kids, and other kids, of course, know what the new language is, or what we're calling things these days.
Yeah, they're my best sources of information. I'm like, so what are you guys doing right now? What are you calling this?
Right.
Yeah,
well, Brandy, thank you so much for sharing.
Sure.
I was so glad you had the devices on you and were able to share those. This is being recorded, so people will be able to look at these again and see them. So thank you so much.
Sure. Thank you.
Finally, I'd like to welcome Isaiah Morales, who's a student at Red Lion High School. Hi.
Hello, Miss Nikki.
How you doing?
Good. How are you?
Good. So I know we just talked to Brandy, but how would you describe the prevalence of vaping at school?
Well, vaping is so common at my school. I walk down the hallways and I can smell the different vape pod flavors. I've seen vapes all around the school, including the bathrooms, the football field, and even on the side pockets of students' book bags. I notice that a lot when we're transitioning from different periods throughout the school day. And I've also noticed that students tend to congregate within the bathrooms in order to vape together. And I've noticed that by walking into the bathroom myself and walking into a big white cloud of smoke.
Wow. Have you heard what your peers say about vaping, or why they got into it or why they continue to do it? Do kids talk
Well,
about that?
yeah, and I've heard from my peers that vaping is a safer and healthier alternative than cigarette smoking. And I've also heard them mention that vape pens don't have any nicotine, which in fact we all know that they do. And I've also heard people say that their friends and parents also use these devices. So they are also peer pressured into using these vape pens in order to fit in and to feel cool.
Isaiah, I don't want to put you on the spot, but you're talking about all types of kids, right? This isn't just like, in perhaps, earlier times we talked about it just being the bad kids or just being a
Yep.
certain type of kid. This is really widespread, would you
Right.
say?
Yes, it is. I know a few people off the top of my head who I wouldn't have thought ever of being a vape pen user. And it really surprises me to see the type of people who use these devices because, like you said before, I always thought it was the bad kids within the school, but it's also other people who may be involved in other extracurricular activities as well.
Right. What do you think? I know you said that, kids a lot of time think it's perhaps safer than smoking regular cigarettes, but what
Right.
are some other misconceptions that you think your peers might have about vaping?
Well, the one thing that they mention is that it doesn't contain nicotine,
Mm.
but vape pens contain nicotine and also contain other chemicals which are um, used to addict you in order for these products to be bought over and over again. And I've also heard that vaping is healthier than smoking a regular cigarette because we know that cigarette smoking can cause black lung and difficulty breathing, but it's the same when it comes to vaping and all smoking in general. And as I've done my own research on this and I've listened into the other panelists, I can conclude that this is more of a marketing ploy when it comes to these vape companies because they are not, unfortunately, they're not focusing on the health risks and the well-being of teens and adults, but they're focusing more on the money that they are getting from these products.
Right, right. And we do know from student surveys that a lot of kids just don't know really what's in them.
Right.
I think you're right on about those misconceptions. So, as a student who's really stepped up to be a leader, what advice do you have for your school about how they can help students either quit vaping or maybe even never start?
I believe we need to consistently educate our students. Like you said, about the long-term effects of vaping and also address the misconceptions with vaping because some students and some people are not aware of what they are inhaling when they're using these devices. And also, like my school has been doing already, we need to continue to have conversations like these and have consequences for students who are using these devices on school grounds and on school premises as well.
That's great. Thank you so much, Isaiah. I
You're
want to
welcome.
thank, I'd love to thank all the panelists today. I'd love for everybody to come back on camera, and I'd love to give everybody an opportunity to just sort of perhaps you want to address something someone else said or add something to the conversation. I know I always think of something 5 minutes later. So I think we'll start at the top with the opportunity to share a final message. So Dr. Silverstein.
Well, I really appreciate all the things the other panelists have said. My head's swimming, with all kinds of thoughts. I guess first, it's very clear that vaping and vaping aerosols are, I think most literature feels they're definitely safer than cigarettes, but that remotely does not mean that they are not harmful. Again, there's no long-term data. And as one of the panelists said, I think Holly, that again, the diacetyl in the flavoring is associated with bronchiolitis obliterans. No one mentioned the term EVALI, which is e-cigarette or vapor-associated lung injury, which was about 3,000 people between 2018 and 19, associated with 60 deaths. That was associated with the mostly inhalation of THC with bootlegged or street-bought vaping devices like dank vapes, which caused acute lung damage and severe injury. So again, they're not harmless, but they, I think, certainly are safer than cigarettes. The biggest issue, and Isaiah brought up also so many important issues, this is going to be a $50 billion industry. These kids are so much quicker, so much smarter at evading and getting away with things and getting and beyond adults' capabilities. They are so smooth. And I mean, I learned a lot of what I learned from kids. In terms of what's out there. I knew about Puff Bars Long, Enjoys. I mean, again, the disposables are really important because the disposables can have flavors. All the other major things have gotten rid of flavors. Flavors have been banned, but not in disposables. For the last administration left disposables, which left 7,000 different types of flavorings out there, which appeals to kids. And the marketing is, as Isaiah said, the marketing is incredible to get these kids to buy their products. And they are reaching them on social media and aspects that most adults are not even routinely looking at. The last thing I wanted to bring up, and for me, that's really, really important, I have to talk to, when I talk, and I've talked to about 7 different districts in Lancaster, I have to start with 5th and 6th graders. The 5th, 6th, 7th, and 8th is about the group because to me, with that group, you can deal with prevention, you can deal with education. They may begin to understand what the problems are and you can reach them early. When I've talked to high school kids, they look at me like another old white dude who's basically here to lecture me. And so with the older kids, it's more about nicotine cessation. It's critical. What can you do? What are the resources, as Brandy was saying, to attach these kids to PA Quit Now, to ditch Juul, to ditch vape, to allow them to, on their own technical aspects, to allow them to reach into texting and things that they can kind of hopefully work on resources to do prevention and nicotine cessation. The biggest issue, and the thing I'm going to end with, is we are woefully undereducated as physicians on nicotine cessation. The real question comes down to, what do we do with these kids? You know, these kids are severely nicotine addicted. So, and the problem is that, again, nationally, as a physician, below the age of 18, we have to write prescriptions for any nicotine cessation devices. So for nicotine patches, gum, lozenges, we have to write scripts under the age of 18. Drugs that we use for adults like bupropion or Wellbutrin and especially Chantix are not really indicated and not a lot of studies done below the age of 16. So again, physicians are tremendously undereducated. We need to feel comfortable treating these kids like actual nicotine addicted adults as well. And the key is, you know, we want to start putting these kids on not just nicotine patches at full strength, but we also want to substitute gum, substitute lozenges. So when they get urges during the day, they have something else that they can use. So I'll stop here. I apologize, but there's just so much that can be said.
Those are great points, Dr. Silverstein. Thank you so much. Samantha, any parting words?
So I'll keep mine simple. And mainly when it comes to preventing substance use in communities, that it truly does take a village and the entire community. So
yes, and I think tonight's webinar is a great example of that, and I hope that we can continue to have an open conversation around this issue. Holly.
Yeah, I guess my closing remarks are quite simple. I mean, it's quite obvious that this epidemic is in full swing. We've seen it coming for close to a decade, and we've seen the use triple in that time. And we have an issue on our hand that we really need to deal with as an addiction. I want to emphasize that the American Lung Association does offer vape-free schools resources, and these are free for schools to use. And also want to really just highlight again, our in-depth program and the NOT program is a free service that can be used regionally through the state. And in Lebanon County, Lebanon Family Health is our source for the in-depth and the NOT program. And we also are working with school districts to strengthen their policy, as we have spoken pretty well in depth today about being non-punitive measures and trying to focus on recovery and from addiction. So,
that's great, Holly. And something that I would like to see, as we continue our work in Lebanon County, hopefully being able to share that work out to the other counties as we are able to hopefully successfully get some of those policies changed. That's a great point. Brandy, so many good things to share. Thank you for bringing all of your show and tell items tonight.
Absolutely. So I have a plea to any of the students that may be listening, and my plea to them is it only takes one to stand up and make a difference and say, look, I don't want to breathe this in. I don't want to do this. Please stop. Like, let's do something different, or let's talk to someone. That's my hope, is that I can get just one student to start making a change. And then the other thing I want to say is to any parents that are listening, please have a conversation, not just with your child, but with your child's older friends, with older relatives, nieces, nephews. I'm finding that a lot of students are getting their first devices from relatives, their younger aunt, their uncle, their older cousin, younger meaning younger than their parents, aunt and uncle. And that's where they're getting their first devices. So please have conversations with your students as young as 8, 9, 10. But making sure that you're also telling your family members, do not encourage this. Please don't support this. I see it time and time again, and it makes me sad that this is happening. So please have that conversation.
Brandy, that's such a good point. We didn't really, there are so many topics we didn't get to tonight, but that's a great one is, where are the kids getting these devices and how are they getting their hands on them? Because, presumably there are age limits, et cetera. And unfortunately, that's a question that's not asked currently in the PAIDS youth survey, is where they're getting their vaping devices. We asked that about alcohol. We've been asking that for years, but hopefully the research will start to catch up with that as well. Isaiah, thank you so much. What do you have to say?
Yes, and like many of the other panelists have mentioned throughout the evening, we all need to educate ourselves, whether it's doing our own research or being a part of conversations like these. Education about this specific topic and all other topics as well is important, and something that teens and as well as their parents and adults should be aware of. And if you are addicted to nicotine or vaping, or somebody that is, get them help. Reach out to a counselor or call a hotline. I have one written down right here, 1-877-44-YOU-QUIT. And you can contact a tobacco cessation counselor and get help and start your way of quitting vaping or smoking.
And there it is. That's a great mic drop, Isaiah. I like that. So thank you guys all so much for talking with us tonight. If you want to learn more about the American Heart Association's resources related to tobacco and vaping, you can of course visit heart.org. We're also on social media for daily updates and health news, resources, and events all across Pennsylvania. You can find us on Facebook, Twitter, and Instagram at AHA Pennsylvania. Definitely want to thank thank you guys for joining our conversation this evening, and thank you to WellSpan Health for their sponsor of tonight's event. So everyone who attended can expect a follow-up email with links to some of the resources that we shared today. If you have any questions, please reach out to Caitlin Reese at caitlin.reese@heart.org. And I believe the email will likely come from her. So thank you again for your attention, and we look forward to hearing from you.